Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. I'd like to acknowledge the traditional custodians of the land on which I'm recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging. I do this because First Nations people, I believe we have a great deal to learn from, particularly about connection and respect, which is very much what this podcast is about. Well, burnout. Burnout is today's topic, and we've touched on that before with Dr. Susie Green from the Positivity Institute, but burnout is something which is affecting a growing number of people who become disengaged and disempowered and exhausted from their job. The Great Resignation is an example of this, but there are many in healthcare, for example, that feel burnt out, particularly after these last 2 or 3 years, but in business in general. And when we're not just talking about healthcare, we're talking about the finance industry, we're talking about teachers, we're talking about people in law. It's a problem that cuts right across our community, and it's busy time where our attention is constantly being vied for, where we're not getting enough sleep, we're not looking after ourselves, we're distracted, we're immersed in a virtual world. Disengagement is a big and growing problem. My guest today is Dr. Clark Gaither. Now, Clark is a board-certified family physician in private practice in Goldsboro, North Carolina. Clark's been in full-time practice of medicine for the past 24 years. Now, like many in healthcare, but actually not an uncommon story, Clark confronted burnout and it changed his life. I won't spoil it for you, but his website, Dr. Burnout, gives you a little bit of a clue. His focus is clearly on burnout, with a mission and a focus summarized in his book, where he asks the question, feeling burned out lately? Reignite is the name of the book, transformed from burnout to on fire, and find new meaning in your career and life. I hope you enjoy this conversation I had with Clark Gaither, MD. Welcome, Clark.
Thank you. Good to be here.
Clark, we're going to be talking about burnout, and I think you're almost described as Dr. Burnout, but I wondered if, because your background is in medicine, I wondered if you could share with us that bit about your journey that's brought you to this point.
Sure. It was in 2009. I went to my practice partner. It was just two of us in a family practice group. I went to my partner and I told him, I said, if something doesn't change, I'm going to have to leave the practice of medicine. What was at once a great source of personal satisfaction and joy and pleasure had really turned into drudgery and dread. I was no longer enjoying what I was doing. I was looking forward to the weekend and dreading Mondays. Then I was shocked by it. I really didn't understand it. I couldn't understand how something I once loved had become so distasteful. And so that set me on a journey really to find out what happened and what I could do about it, because I wasn't ready to give up on medicine. I was just wanting to find out how I could make myself feel better.
Were you in general practice at the time?
Yes, I was in a family medicine practice in a rural city in eastern North Carolina.
And I mean, that is such an integral part of a community, I imagine, that feeling disconnected from it has all sorts of implications just generally within your whole world.
It sure does. I spent quite a long time, a lot of energy and resource getting into medicine. And I was only in my 17th year of practice. And so I was quite dismayed and disheartened about how I'd come to feel. At first, I really didn't know what I was doing. I made some changes that I thought would help. I reduced my hours. It meant taking a cut in pay, but at that point, I really didn't care. I would have paid somebody to make me feel better. So I paid myself by taking some time away from the practice. I started reading outside of medicine, started picking up old interests and old activities and hobbies. I was running more for exercise, getting better rest. I was doing all those things we ask our patients to do. And in weeks, I felt better. It was only later that I found out, after nosing around on the internet some, that I was suffering from what's been termed professional job-related burnout.
And I imagine, and I'm sure these last 2 years haven't helped, I mean, your background is medicine, healthcare. They have really been at the coalface, haven't they, in these last few years? And I imagine that's not an uncommon thought going through many health practitioners' minds, particularly doctors.
Right, you are. The burnout rates in medicine were very high and climbing prior to the pandemic. The pandemic really served to amplify the hallmarks of burnout and intensify the underlying drivers. And so we've seen, I work for now I work for a state professionals health program. And so we saw a wave of practitioners after things began to loosen up and after the pandemic began to die down. We saw a wave of practitioners that were in trouble or troubled by drugs, alcohol, depression, suicide thoughts and ideations, acting out in various ways. And it was all a result of the stress that they were under during the pandemic.
I think another group that's takes a big hit too are teachers and nurses who were really, again, at the coalface, being asked to do things above and beyond.
The caring professions in general usually carry higher rates of burnout because of the emotional impact of the work, of the type of work. So yeah, medical healthcare personnel, teachers, firefighters, police officers, social workers, all of those professions got hit pretty hard by the pandemic. But again, even before the pandemic, burnout rates were high and climbing.
Yeah. So let's talk about burnout, and how do we define it?
Well, this was figured out in the 1980s by a very smart doctor by the name of Christina Maslach. And she developed actually the Maslach Burnout Inventory, which is a screening tool for professional job-related burnout or job-related burnout in general. And that tool has held up since the 80s. For the last 40 years, it still has scientific validity and is very accurate at measuring burnout in a particular individual. And it measures three things. There are three principal hallmarks to burnout. The first is emotional exhaustion. And that's when the person becomes, they feel like they've left it all out there, that they've given all that they have to give, or that they have nothing left to give. They can no longer connect on an emotional or psychological level to the client, the customer, or the patient, or their staff or colleagues. The second hallmark is depersonalization. That's a fancy term for the individual becomes cynical. They develop negative feelings toward those they serve, and they develop negative feelings toward what they do. And they also disconnect from what they do and who they serve. So they no longer feel that sense of connection that they once did for their chosen job or profession. And the last hallmark is a lack of a sense of personal accomplishment. And that's when the individual feels like no matter what they do, it's not making a difference. They feel like it's not making a difference in the lives of those they serve. And it's also not making a difference in their life anymore. They no longer feel that intrinsic reward from the job that they've chosen to do. So those are the three hallmarks or symptoms of burnout: emotional exhaustion, depersonalization, and a lack of a sense of personal accomplishment.
I mean, this casts my mind to a study that was done by the Gallup organization looking at engagement. And I know engagement in the workplace is a huge issue.
Right. And it's the exact opposite of burnout. The three hallmarks of engagement are vigor, dedication, and absorption. Vigor is energy, which is the exact opposite of emotional exhaustion. Absorption is involvement. And so rather than detaching, you get involved. And absorption is when you are so into your work that all else seems to melt away. And so the key word for that is efficacy. People feel like they're efficacious in what they do. So it's the exact opposite of a lack of a sense of personal accomplishment. So the engagement then is the exact opposite of burnout. And everybody wants to be engaged, and every business owner wants engaged employees that demonstrate the vigor, the dedication, and the absorption in their work.
Because I think people are very familiar with the term absenteeism. That's an obvious one. You just literally didn't show up for work. But presenteeism is another term that's kind of somewhere. Is that part of the process? Presenteeism is on the road to Damascus or on the road to burnout.
Exactly. I mean, people can put their head down and grind away at a job they hate and a place they detest for years or even decades, but they'll put a smile on their face and they'll fake it, but inside they're saying, I hate this place and everything it stands for. The problem is if they do that, then they can end up bitter and angry and resentful, and it will shorten their life. And so that's no way to live, in my opinion.
Yes. Well, you're out there looking not just in the health area, I think nowadays, but what impact is this problem having on business?
Well, it has a tremendous impact. I can speak for my business for sure, but there are parallels with any business. For the healthcare industry, high burnout rates translates to a high turnover rate. So if a business is turning over or churning through employees, there's something wrong with that work environment. It's probably a toxic work environment that's driving people away. And by the way, 90% of burnout is caused by the work environment. Only 10% of the time do people burn themselves out. 90% of the time, it's the work environment. It also translates into high burnout rates translate to medical errors. A 1 point increase on the depersonalization score on the Maslach burnout inventory translates to an 11% medical error rate.
Wow.
And so it can cause a lot of medical errors, and employee dissatisfaction, patient dissatisfaction. On the other side, in the business world, it would be employee dissatisfaction, customer dissatisfaction, high rates of absenteeism, higher rates of on-the-job injury, increased malpractice claims in the healthcare industry, or increased suits in the other industries. So there's a high price. Employers, healthcare organizations, large provider groups, they're already spending a lot of money on burnout. They just don't know it. And it's not the way they would intend to spend it if they were a little better educated about the problem.
That's so interesting to hear you say 90% of the cause of burnout is the work environment. What are some features of a toxic work environment? I mean, people may be actually experiencing it without it actually having the word toxic attached to it. But what are some of the features of a work environment that are toxic?
So Christina Maslach also figured this out back in the 80s. And she developed a tool for measuring this. It's called the Maslach Areas of Work-Life Survey, or MAWS. And it measures the 6 major employee job mismatches that create burnout. So a minute ago, I talked about the hallmarks or symptoms, but these are the underlying causes. And see if this might sound familiar. Work overload, lack of control, insufficient reward, breakdown of community, absence of fairness, and conflicting values. So there isn't a single one of those that wasn't being negatively impacted by the recent pandemic. Many providers were work overloaded. They were exhausted because they were called upon to work extra hours under unfamiliar circumstances that were not to their liking most of the time. So everybody's feels work overloaded at times, but in certain areas, in order to save money, companies have really loaded up employees with too much to do. There's just too much on their plate, and nowhere is that truer than in medicine. Not only are providers supposed to take care of a long list of patient responsibilities every day, but now 30% of their day is administrative, which is something they don't want to do and weren't trained to do. So that kind of work overload has a negative impact. Lack of control. Large organizations tend to want to centralize control. And so what that does is it stifles innovation and creativity at the point of service. So people can't adjust or make accommodations on the fly because there's some company policy they would violate if they did so. And so the more and more control is taken away from, in my industry, the provider and given to somebody else who often isn't even educated in medicine, i.e. some bureaucrat somewhere. And so this is very dispiriting to the healthcare provider. One provider put it best. He said, every day I go to work, I'm faced with 1,000 tiny betrayals of purpose. And that's kind of sums up exactly the way providers are feeling. Insufficient reward. A lot of their rewards have been taken away from a lot of folks' jobs because they're either too busy to enjoy a thank you from a customer or a patient, or they're few and far between because the amount of time they get to spend with them is so short. The thank yous get further and further apart. And so a lot of the intrinsic rewards have been taken away. Breakdown of community. Everybody has to feel like they're pulling on the same rope in the same direction in an organization. And when everybody's pulling in different directions, it doesn't foster a sense of community or a common purpose. And then the next one, absence of fairness. In order for an employee to feel like they're being treated fairly, there must be openness and honesty and trust. And if those things are missing, or if they're lacking, people don't feel like they're being treated fairly. And then the last one, conflicting values. That's a big one. That will drive people away more than anything. If a company you're working for is asking you to do things that are kind of shady or sketchy, or maybe they're actually asking you to keep the information from your customers or patients, or sometimes out and out lie, the honest people will not stay. They will leave that place. And so of those 6 things, those are the 6, there are more than 6, but those are the 6 major underlying causes of burnout in the workplace. And if you negatively, it's not just the number that are being negatively impacted, it's the degree to which they're being impacted. You can impact all of them a little bit and nobody's burning out. Or you can impact one severely, like conflicting values, and people will be jumping ship by the busload. So it's not only the number, but the severity of those 6 underlying mismatches.
I mean, I think the first one, work overload, is such an interesting one, isn't it? Particularly at this time of the bottom line, cutting staff. Productivity is a very, trendy word. It has been for the last 20, 30, 40 years, always pushing to increase productivity. I mean, I think it's true in healthcare, but it's also true in so many other industries. There's a point of diminishing return in terms of time spent.
I tell people this analogy all the time. A racehorse, the jockey on a racehorse, they have a riding crop or a whip, and they can, whip the horse a little bit and make it go faster. And they might whip it harder and it might go faster still. But at some point, no matter how hard you whip that horse, it's not going to go any faster. In fact, it will start to slow down and become less sure-footed. So you can only squeeze so much juice out of a lemon. and people are being squeezed now to the limit. And it's one of those things where as long as the employee continues to try to accommodate more and more, there's no incentive for the administration or boss to give them less. So sooner or later, the system's going to break. I think it's reaching a breaking point even now, and there's going to have to be some sort of paradigm shift away from the way we're doing business and medicine right now. And I know that's going to happen because the current path that we're on is unsustainable.
Well, I think this is true of business in general. It's about, do you take a reactive response to problems like stress in the workplace, or are you proactive? What's your experience in as you engage with different companies or groups? Are there many people leading the way, showing a proactive approach to this, or is it mainly reactive?
I don't know. Again, I'm sort of locked into my industry of healthcare. I can tell you that only 5% of the healthcare, large healthcare providers in the country have advanced thinking along these lines. 95% do not.
Wow.
And so it's rare to get a healthcare organization to really stop giving lip service to burnout and start actually doing something about it. Everybody wants to get together and talk about the symptoms, or, everybody agrees it's real. Everybody agrees it's getting worse. Everybody agrees something needs to be done. And then everybody goes home and nothing changes. And, or they'll focus on the symptoms. They say, well, our workforce is overly stressed. Let's bring in some mindfulness people and some yoga people and some time management people and some resilience training. And all of those things can help with the symptoms of burnout. But unless you correct those underlying causes, nothing's going to change. And so most organizations don't want to hear this message. It depends on how it's delivered, but in their head, they're thinking they're going to have to upend their organization and change things completely about. And it's not about that at all. In fact, small changes can make a big difference. And so the message I like to give is, Mr. CEO or Miss CEO, how would you like to decrease your turnover? I see your turnovers, somewhere between 5 and 10% a year. How would you like to get that down to 3? How would you like to decrease employee complaints? How would you like to decrease patient complaints? How would you like to decrease medical errors and malpractice claims? Does that sound good to you? And if they bite and say yes, and say, well, we've got a roadmap I can lay out for you that can make needed change in the workplace that will cause all of that to happen. And there are plenty of papers and studies to prove it. Burnout mitigation, elimination, alleviation is not only cost saving, it's income generating. Everything gets better when people are engaged rather than when they're burned out.
I want you to say that last bit again. It's not, that rolled off the tongue very well there. That bit, go on. It's not mitigate. Give it to me again.
It's burnout mitigation, alleviation, elimination is not only cost saving, it's income generating. And it's simply because an engaged workforce is a better workforce than a burned out. If you just think about it in your head, everybody's pulling on the same rope in the same direction. Everybody feels like they're being treated fairly. Nobody feels like they're overly work overloaded compared to somebody else in the organization. They have some control over their book of business and their day and can make decisions on the fly. They can innovate. They can create. In other words, you've given them a workplace to blossom using their own natural set of talents and abilities and work experience.
Well, you've just listed out very quickly there some strategies for dealing with it. When you do get buy-in for a proactive approach to burnout, what are some of those strategies you'll go into? You mentioned them very quickly, some things there, but what are some strategies you use to deal with this issue when you get buy-in?
So again, I'll refer to my industry, but the same blueprint or roadmap can be used by any business or any industry. And that is, you have to survey your workforce annually using something like some tool that has scientific accuracy and validity and repeatability, and has a record of comparison that you compare your data to. So if we consult on a hospital, for instance, or a large medical group, we would go in and do the mass-like burnout inventory and give that instrument to every employee. It takes about 10 minutes to fill out. The results are blinded, so nobody, feels like, they're going to say something, or their responses are going to come under some sort of scrutiny that might garner them some sort of negative impact. That doesn't happen because it's group reporting. All the results are reported in aggregate. So then you find out, that will tell you how burned out your organization is compared to similar organizations. Then you apply the mass-like areas of work-life survey to see where the negative impact is on those 6 underlying drivers. And then you present that data, we present that data, and then comes the working group or the working session, where you pick the worst 2 underlying drivers and say, okay, what can we do to increase control? How can we decrease lack of control? What changes can we make in the workplace? I'll give you an example. One hospital, it took the provider somewhere around 15 or 18 clicks to get to his landing page within the electronic health record system. It should take 2 at most, maybe 3. It shouldn't take 15. And so that was an easy fix that could be done, and it can have immense return, because people don't feel like they're spending most of their day just trying to log in to the computer system to find their particular landing page. So you get everybody in the room, because all of the expertise, all of the experience, and all of the knowledge about what the problems are already in the room. I'm an outside observer. I don't know how things work in hospital A or hospital B or hospital C. And so once we identify the underlying drivers, we sort of have brainstorming sessions. What can we do to decrease the negative impact on these 2 worst underlying drivers? And then you make some changes in the workplace. You put some different policies or procedures in place to reduce that negative impact. Then you wait some specified length of time. Then you resurvey and see if you move the needle. And this should be an annual thing. Just like we tell people to go to the doctor once a year and get a checkup, businesses should get this kind of checkup every single year, because employees come, employees go, the conditions on the ground change. So the negative impact on those underlying drivers may shift. And if you improve these 2, well, what's next? What about this one over here? It got a little worse this last period. Let's work on that one. And so you do this annually, and it's not expensive. It can be done very cheaply. The instruments, you can buy them online. You can survey 1,000 people with 3 group reports for $3,500 to $3,700. 1,000 people.
Mm-hmm.
That's not expensive.
No.
Especially some of the coin that businesses drop for seminars and, things that have proven to be ineffective. I think it's time they start spending some time and attention and resources on things that have proven to be effective.
Well, you mentioned 5% are proactive and 95% are not in this area. And I agree with you. Probably that translates through our community, through businesses.
Right.
Where does this change? I mean, how could or should an HR team approach this? I mean, what's the drivers there?
Who should approach it?
Yeah. I mean, how does a company turn that around? I mean, obviously leadership needs buy-in.
Okay. First, there has to be a willingness to change. I don't know who said it, but if you want some things to change, you're going to have to change some things. And so just becoming willing A little bit of education. There's a great book, by the way. Christina Maslach wrote it, called The Truth About Burnout. It tells companies and individuals what burnout is, what the underlying drivers are, and how to address them. And so it usually takes somebody to sort of push the ball down the field. You need a champion in an organization. The National Academy of Medicine in America has recommended that all large healthcare systems hire a wellness, just went right out of my head. Director. Thank you. Yeah. Wellness director and give them a mandate and a staff and a budget and some authority, and let them begin to address this thing we call professional job-related burnout in real terms.
It's good to hear that a piece of research like that Maslach research has stood up to so many years of scrutiny, and probably more relevant today than when it was first drafted all those years ago.
Sure. And if you get a group report, there's a clearinghouse of survey instruments, if you will, called mindgarden.com. You go to mindgarden.com and look up Maslach burnout inventory. It will pop up, and I think for an individual report where the person's name is on it, and you get an individual report, it's like 7 or 20. You can get a combination Maslach burnout inventory and Maslach areas of work life survey for like $20. If you get a group report where you've got a big group of people and the names aren't shared, it's aggregate data, it's $3 a person. So it's very cheap. And in that report, it will compare your group to 33,000 other healthcare personnel across the country. So you know where you stand. If you're better off than that comparator group, if you're the same, or if you're worse off than that comparator group. And so they've amassed this data over decades. And so they've got a tremendously large database. And now they're starting to break it out. It was healthcare providers like MDs, DOs, PAs, nurse practitioners, that sort of thing. But now they're starting to break it out into radiologists and cardiologists, and they also have the Maslach burnout inventory for social workers, and then the general public. So there's 3 of them. There's one for healthcare providers, social workers, because it's a different crowd, and then the general public. And so these tools are sitting there. They're just tremendously underutilized.
Yeah. I mean, I think the statistics tell us that, you said 90% of burnout comes from the workplace. And right. I think Gallup did a recent survey showing that leadership, not surprisingly, I guess, was a major source of stress. Or perhaps they could have added lack of leadership.
Yeah. And you have to be careful when you're talking about burnout mitigation. The last thing you want to do, if you've got work overloaded employees, the last thing you want to do is give them additional things to do. What you want to do is unburden them from some of the rules and regulations. And, oddly enough, COVID or the pandemic has served to point out for a lot of businesses that people can work from home and can be productive doing, if they're managed properly. And so a lot of people have rediscovered their joy for work, if you will, because they don't have to fight traffic for 45 minutes in the morning and then worry about where or what they're going to eat for lunch or how much it's going to cost, and fighting the weather, and then 45 minutes back home in the evening. And so they've freed up an hour and a half of their day just in transit. And so that should give businesses a little inkling that, hey, maybe what we're doing now and the way we're doing it is not exactly working well. So maybe we should think about doing it some different way.
And it has done that, hasn't it? It's legitimized work from home, which was always seen as a very soft option. Oh, come on, you're not in the office where we were all working. It's actually legitimized that. Do you think that's been
Right.
the great driver? I think we've used the term the great resignation. I'm sure you've heard of that term.
I've heard. Yep.
Is that what you're seeing out there in the world?
I think there are still a lot of people that are able to work that have chosen not to. Of course, they may be suffering from a different occupational problem than job-related burnout. They may just enjoy not working.
Yes, it's tempting, isn't it?
At all. But, it's interesting. A lot of entrepreneurs became entrepreneurs because they got burned out at their job. They just couldn't take it anymore. And they thought, is this why I'm working so hard? Is this all there is? And they went off and developed their side business and have done well with it. And, somebody famously said an entrepreneur is somebody who trades a 40-hour work week for an 80-hour work week. It is true. Entrepreneurs work a lot of hours, but why they're able to do it and why many of them don't burn out doing it is because it's what they love doing. That's what they wanted to do all along and probably should have been doing. And so I tell folks, if you're in a toxic work environment that won't change and you've got skills and abilities and education, your skills are highly portable. They'll go wherever you go. Leave that place and go someplace that is more conducive to your natural set of talents and abilities and core values and moral compass, or start your own business because you've got, plenty of brain cells up there that can get you through. So don't just grind away in a place you hate and a job you detest. If your life needs some change, then if you can't change your work environment, then change work environments.
Well, I think you may have just answered my next question, which was how do you avoid burnout if you're faced with it, or how do you even deal with it? What would you like to flesh out of that a little bit more? How would you avoid it? If someone's listening to this and going, do you know what? I think I'm there. Or I might be. How do I avoid it?
Well, sure. Well, I'll address the 10% that burn themselves out. They usually burn themselves out by workaholism. They work too many hours to the exclusion of all else. And what's ironic is they might like what they're doing so much. That's why they work so much. But over time, if you don't live a life in balance, it can burn you out. And so try to avoid workaholism. Try to have a life in balance where there are other things that you're interested in, other things that you do. You spend time with your family and friends. You explore and out, this big old world we got out there and have some fun. Just don't work all the time. Another way people burn themselves out is developing an addiction. If you're addicted, you will never reach your full potential, ever. And so that's one way a lot of people burn themselves out. Or they'll have a bad social life or an endless string of toxic relationships that kind of slop over into their work, where they're always calling in, and it just makes life difficult for them. So you want to avoid those things. So that's how people burn themselves out. Now, as to the work environment, 90% of burnout is caused by the work environment. If you can get the attention of administration and the big boss or the CEO and deliver that message in a kind way that I was talking about earlier, in a way that makes sense, maybe, just maybe, it will pique their interest and they'll do something about the work environment. If you feel like you're beating your head against a wall and they're not going to change, in fact, they told you they're not going to change, then you've got a decision to make. Do I stay here where I have no control, where I'm work overloaded, where I don't feel like I'm being treated fairly, my values are conflicted? Or do you take your skills and your talents and abilities and go someplace else that would better appreciate you? People can get in a burned out mindset where they will place roadblocks in their own path. They'll say to themselves, it's too late for me. I've got too much time invested here. I don't have the right skills to go over there. I won't make as much money over yonder. They create these scenarios in their head, but it's really part of the burned out mindset. And none of that's true. You got where you are by your efforts and your energy and your knowledge. You can go someplace else and start over and end up better off. And so I always challenge people, don't stay where you're not appreciated in a job that you hate. Look around. Now, I don't suggest that people leave, A until they have a plan B. You got to get your resume punched up and you've got to start looking around and put out some feelers. But you can do all of that and prepare to launch and find a better work environment that's not toxic.
I think that encouragement to engage with management in a very caring, calm way is a really important point there to not just assume, but to actually approach it in that very calm and proactive and positive way. It's the way you frame a question or a statement that makes such a big difference, doesn't it?
Sure. And again, everybody's in the same boat. And you can say what without emotion and without any shaming language or blaming or ridicule, you can say, look, this is what I've observed. I don't think you think that sounds right, but here's what I think we can do. And then list those things that burnout mitigation, alleviation, elimination will do for an organization, and say, I think that sounds interesting. Don't you? Don't you think that sounds interesting? And maybe it's something we can look into, because there are plenty of studies that show that this stuff works. Everybody wants to, who wants to live a life where you're just dreading getting up in the morning, going to work day after day, year after year, month after month? I mean, it just sounds like slow torture. So it doesn't have to be that way. There are organizations and companies out there that get it. Microsoft is one of them. They stopped hiring, a long time ago, just based on educational background and, can you write code? And if you can work from home. You can come in, they have dress down days. They have they have cafeterias and all these things for employees that make the work environment so nice, nobody wants to leave, not willingly. Yeah. So in North Carolina, up in Research Triangle Park, there's a company called SAS Institute. And I don't think anybody's ever quit SAS unless they had a real good reason, because the work environment is so good. People feel like they're on a team, a real team. And so there are companies around that get it. And like I said, I think more will as time goes by, because the companies that get it will do better than the ones who don't.
Well, I've often said that companies that focus on their health and well-being of their staff are companies people want to work with and companies that people want to work for. So, right. It's a win-win both ways.
Well, everybody wants to focus on the bottom line. I hear this, well, we got a bottom line we got to focus on. And I say, your employees are your bottom.
Yeah. And this is the whole idea about return on investment. This is such a great return on investment, isn't it? The focus on health and well-being of the team. Now, exactly. just you've given, actually, what you've done here, Clark, is, for that person who wants to start a conversation, you provided the structure and the science, because if Christina Maslach's work is still valid after 30 or 40 years, that's probably a good structure to start a conversation with your employer. I want to ask you a final question, taking a step back from your role as a doctor, as a Dr. Burnout, focused on burnout, because we're all on a health journey in this modern world. What do you think the biggest challenge is for us as individuals on that health journey?
Self-care. People don't take care of themselves like they should, and they know it, and they secretly know this. consciously. It's not a subconscious thing either. They know they need to get off the sofa and go for a walk. They know they need to drop some pounds. More than 50% of the chronic illnesses we deal with would go away if people took better care of themselves. And by the way, I'll include physicians and a lot of healthcare personnel in that group. Healthcare providers are terrible at self-care. You think they would be great at it, but they're not, because they kind of run around seeing everybody else's needs rather than seeing to their own. And so those things that we talk about really mean something. Get adequate rest, eat properly, keep your weight down, exercise regularly, get checkups. I mean, just those alone, 50% of what we deal with would go away. Self-care.
Yeah. Clark, thank you so much for joining us today and sharing your knowledge and wisdom with us. And thanks for doing that. And we'll have links to your website and all of your material there. Thanks very much.
Well, you're certainly welcome. It's been a pleasure.
Well, I know that the Gallup poll has been done a few years ago, and I think they surveyed something like 142 countries and millions of people. And what they came up with was rather disturbing, and that is that only about 15% of workers are actively engaged in what they are doing. I think there's something like 65% or 68% who are indifferent, are just showing up to work as a place to work, and the rest are actively disengaged. So something is seriously going wrong in our work-life balance, and burnout is one manifestation of it. And I think very interesting to look at the work of Christine Maslach, who did a lot of research on this in the 80s and 90s, and it has still stood the test of time. So there is clearly much in what she has uncovered, and which Clark and Dr. Susie Green in a previous episode had been discussing. And it might be worth us all going on to do that Maslach inventory of whether you really are burned out or not. We'll have links to that in our show notes, and we'll have links to Clark's website, of course, as well, Dr. Burnout. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well.
This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.